Let's be completely candid for a moment. If you value your physical vitality, your confidence, and your future longevity as a man, this is a discussion you absolutely cannot afford to overlook. Today, we are breaking down 10 specific behaviors, some of which you might be doing daily, that quietly compromise erectile function, diminish nerve sensitivity, and place your long-term intimate health at serious risk. My goal today isn't to provoke fear, it is to equip you with clinical knowledge. Because the moment you understand exactly what to avoid, you gain the power to shield your performance, your self-esteem, and your dignity for the rest of your life. Before we dive into the list, take a quick second to hit that like button so this vital health education can reach more men who need it. Subscribe to the channel if you haven't already, and drop a comment below letting me know where you are tuning in from. I genuinely enjoy seeing our global community of men taking proactive control of their well-being. Now, here is a foundational truth most men completely overlook: your anatomy functions exactly like a primary check engine light on your body's dashboard. Whenever systemic issues begin to develop, whether involving your blood flow, your metabolic hormones, or your cardiovascular system, your erections are almost always the very first indicator to show signs of trouble. A softening or inconsistent erection isn't just a streak of bad luck or an inevitable consequence of blowing out more birthday candles. It is a direct cellular message from your body that a deeper issue requires attention. If you ignore that warning light, you risk missing a vital window to prevent major systemic issues like cardiovascular disease. But if you pay attention, you can actively reverse the trajectory. For those new to the channel, my name is Dr. Nerita. I am a board-certified urologist, and for the past 12 years, my clinical practice has specialized exclusively in men's health and sexual medicine. Having treated thousands of patients navigating erectile dysfunction, low testosterone, and prostate health, I can tell you with absolute certainty, small, intentional daily shifts yield monumental results. Let's map this out step by step. These are the 10 absolute counterproductive habits you should never inflict on your body, and more importantly, the clinical adjustments to make instead to remain firm, healthy, and resilient. Make sure to stay with me until the very end, where I will share an evidence-based, natural mechanism to support optimal circulation without relying solely on standard prescription scripts. 1. Disregarding subtle structural changes. Your anatomy serves as the ultimate early warning sentinel for your vascular system. When a man notices his erections losing rigidity, it is highly indicative that his endothelial lining is compromised and blood vessels are narrowing. Because the penile arteries are incredibly microscopic compared to other arteries in the body, they manifest circulation blockages years before the larger vessels feeding your heart or brain do. The biology: this exact circulatory timeline is why clinical data shows men experiencing new-onset erectile dysfunction carry a significantly higher risk of experiencing a major cardiac event within a 5 to 7 year window. The emotional impact: turning a blind eye to these changes out of denial means missing the ultimate early window to shield not just your intimate life, but your entire lifespan. The practical takeaway: if you track a shift in your baseline firmness, do not dismiss it as a fluke. Pay close attention and investigate it early. 2. Experimenting with dangerous home remedies. Over my 12 years in urology, I have witnessed nearly every imaginable internet myth attempted in private: men applying concentrated apple cider vinegar directly to delicate tissue, constructing makeshift traction devices out of household hardware and elastic bands, or performing aggressive manual stretching techniques. These practices induce severe microtears, irreversible nerve trauma, deep scar tissue formation, and permanent structural ED. In my clinic, I have routinely treated patients who had to be rushed to the emergency department with rigid metal constriction bands completely stuck. In severe cases, emergency crews had to use specialized industrial power tools just to safely cut the rings away. The practical takeaway: if you choose to utilize assistance tools like constriction loops, strictly utilize medical-grade, flexible options engineered with built-in quick-release mechanisms. 3. Neglecting routine, basic hygiene. While this sounds elementary, hygiene complications remain one of the most frequent reasons men visit my clinic. For uncircumcised men, it is clinically vital to gently retract the foreskin, cleanse the underlying tissue using warm water and a highly mild soap, rinse thoroughly, and pat the area completely dry. Failing to do this allows smegma, a buildup of shed skin cells and natural oils, to accumulate, triggering severe bacterial infections, painful inflammation, and in rare, prolonged scenarios, an elevated risk of penile malignancy. The counter mistake: do not overcompensate by scrubbing with harsh, heavily fragranced antibacterial soaps. This aggressively strips away the natural lipid barrier of the skin, inducing chronic dermatitis and painful cracks. Consistent, gentle maintenance is the gold standard. Overlooking pain, bleeding, or unusual lumps. This is a critical area where men frequently delay care out of fear. Experiencing acute discomfort during intercourse, noticing blood in your urine or semen, or discovering a new firm nodule or persistent ulcer are developments that should never be ignored. They can indicate anything from localized infections and urinary tract stones to, in rare cases, underlying malignancies. The biology: these symptoms are explicit red flags from your immune system indicating that localized tissues are actively under cellular stress or trauma. The emotional impact: ignoring these signs delays life-saving interventions and creates massive psychological performance anxiety in the bedroom. The practical takeaway: if you detect any abnormal physical development, secure a clinical evaluation immediately. If a provider ever makes you feel embarrassed or judged, find a new practitioner. You have an absolute right to clinical care free from shame. 5. Taking unnecessary physical risks during intimacy. True performance confidence is completely intertwined with physical safety. I cannot overstate this: penile fractures are absolute urological emergencies. When a fully rigid penis is subjected to a sudden, blunt bending force during intercourse, the dense fibrous sheath known as the tunica albuginea literally tears open. This results in an audible popping sound, immediate agonizing pain, rapid swelling, and severe internal bleeding. Clinically, we refer to this visual presentation as the eggplant deformity. The practical takeaway: if you ever experience this type of trauma, bypass the clinic and head straight to an emergency room for immediate surgical repair. Additionally, never skimp on high-quality lubrication. A lack of natural moisture isn't a reflection of your partner's desire, it is often driven by hormonal shifts, daily medications, or systemic stress. Using adequate lubrication reduces structural friction, protects both partners from microtears, and allows you to maintain comfortable control. 6. Submitting your testicles to extreme heat. There is a profound evolutionary reason why the testes are positioned completely outside the main abdominal cavity. To successfully synthesize healthy testosterone and produce viable sperm, they must be maintained at a temperature roughly 2 to 3 degrees cooler than your core body temperature. The biology: subjecting this region to prolonged high temperatures degrades sperm quality and downregulates Leydig cell testosterone production. The practical takeaway: avoid spending extended periods in scorching hot tubs, never rest a warm, poorly ventilated laptop directly on your lap for hours, and transition your smartphone out of your front pants pocket into a jacket pocket or briefcase. 7. Applying excessive grip pressure during self-stimulation. A highly prevalent issue among modern men is a phenomenon known clinically as death grip syndrome. When a man routinely utilizes an incredibly tight, high-friction grip during masturbation, he conditions his nervous system to only register extreme, unnatural levels of physical stimulation. The biology: this practice progressively desensitizes the delicate mechanoreceptors and nerve endings in the skin. The emotional impact: when transitioning to partner intimacy, the natural landscape of a partner feels comparatively muted, leaving the man frustrated, unable to maintain rigidity, and emotionally disconnected. The practical takeaway: intentionally lighten your manual pressure, introduce a high-quality lubricant, and allow your nervous system to retrain its sensitivity to gentle, organic sensations. 8. Chronic smoking and nicotine delivery. If there is one lifestyle habit mathematically guaranteed to decimate erectile quality over time, it is smoking. Nicotine is a potent vasoconstrictor that directly ravages the delicate inner endothelial lining of your arterial walls. This structural damage severely blocks the natural production of nitric oxide, the fundamental chemical messenger responsible for signaling your blood vessels to relax and expand to allow an erection to occur. The clinical risk: beyond erectile failure, smoking introduces severe carcinogens into the bloodstream that concentrate in the urine, making it the leading risk factor for bladder cancer, one of the most aggressive conditions we manage in urology. Quitting immediately protects your vascular performance and your overall survival. 9. Succumbing to psychological performance anxiety. Men frequently conflate their core self-worth with their immediate sexual performance. However, human biology dictates that every single man alive will experience an off night due to fatigue, stress, or distraction. The moment you allow a single off night to spiral into intense mental panic, your brain rapidly triggers your sympathetic nervous system, the classic fight-or-flight survival loop. The biology: the moment fight or flight initiates, your body floods your system with adrenaline, which immediately constricts the pelvic arteries, shunting blood away from the extremities to protect core organs. This makes an erection physically impossible. The practical takeaway: remind yourself that your masculinity is vastly larger than a singular moment. Speak openly with your partner, consult a medical professional, and refuse to carry the mental weight in isolation. 10. Allowing the anatomy to enter long-term disuse. The classic physiological rule of use it or lose it is entirely real when it comes to pelvic vascular health. Healthy, regular erections act as a natural delivery system, flooding the internal smooth muscle tissue with highly oxygenated blood. This continuous oxygenation is what keeps the tissue elastic, healthy, and highly sensitive. The biology: without regular blood flow, the smooth muscle cells can slowly undergo microfibrosis, meaning elastic tissue is replaced by rigid scar tissue, which can cause a gradual loss of baseline sensitivity and even a subtle reduction in functional length over time. The practical takeaway: nocturnal erections during REM sleep are your body's automated maintenance cycle. If you notice these nighttime or morning erections have completely vanished, it is a clear indicator of a deeper circulatory or hormonal shift. Even solo stimulation is a vital therapeutic practice to preserve cellular oxygenation and tissue health. The clinical roadmap to recovery. To fully protect your vitality, focus on your foundational vascular health. Boost your pelvic circulation through structured cardiovascular exercise and nutrient-dense nutrition. Safeguard your endocrine system by aggressively managing daily stress, securing deep sleep, and clinically evaluating your testosterone biomarkers if you track persistent symptoms of low vitality. If you are looking for an evidence-based, natural protocol to optimize your daily nitric oxide production and blood flow, consider incorporating targeted amino acid supplementation like L-citrulline, derived naturally from concentrated watermelon extract. Once ingested, your body highly efficiently converts L-citrulline into L-arginine, which serves as the direct precursor to nitric oxide, $NO. This vital gas signals the smooth muscle lining of your penile arteries to rapidly relax, widen, and accommodate maximum blood flow right where it matters most. I will place my fully vetted, clinically trusted recommendation in the pinned comment and video description below. A final word from Dr. Nerita. Please listen to me clearly: encountering erectile difficulties is never a reflection of diminished masculinity, nor is it a valid reason for personal shame. It is simply an internal biological signal. And signals are meant to be clinically decoded and acted upon, never feared. I routinely see patients in their 50s, 60s, and well into their 70s completely revitalize not just their intimate health, but their foundational physical energy, mental confidence, and closest relationships. Small, evidence-based habits executed with strict consistency yield massive transformations. Take this discussion as your definitive wake-up call. Respect your biology, protect your anatomy, avoid these 10 critical mistakes, and you will secure your performance, your dignity, and your health for the decades ahead. If this breakdown brought you value, please share it with a man who needs to hear it. Hit that like button, subscribe to stay updated with our weekly medical deep dives, and drop a comment below sharing the single habit change you are committing to starting tonight. I'm Dr. Nerita, and my mission is to keep you deeply informed, resilient, and fully confident.